Yes. Hi, hello everyone. Am I audible? Am I audible? Can anyone reply me? Yes, yes. Okay. Arish Ali. Yes. Mahak Rajput. Yes. Let's start. FMT recall. That is asked in your paper 2. Okay. Sanket. Dr. Arish Ali. Yes. Good evening. So let's start the recall. As usual, the forensic is a scoring subject in any exam. So in paper 1, there were 12 questions. And in paper 2 there were around 10 to 11 questions asked. So let's discuss all the questions and proper answer for those questions, right? I think this is the question taken from forensic ballistic. As you know, forensic ballistic is one very important chapter, very commonly asked in the exam. Okay, let me read the question and option. If I am wrong, you can correct me in between regarding the option and the question. During postmortem examination of suspected case of rifle firearm injury showing entry wound with blackening, the probable range is, options are contact shot, close shot, near shot, distant shot. Yes. Nimra Adoni. So blackening was not there. Fine. So blackening was not given. Okay. Near shot was not there. Okay, this option was not there. Can you recollect the option? Recollect the option. One option for sure, contact shot, close shot, distant, right? Achha, blackening was there in the picture. Fine. So blackening was there in the picture. Okay. Any correction? Anyway, see, whenever you see blackening, what is blackening? The blackening is because of the burnt gunpowder, right? Gunpowder which is burnt. Yes or no? Okay. Intermediate. Okay, instead of near it was given intermediate. Intermediate shot. Fine. Okay. Was it rifled weapon or shotgun? Anyone can correct me? Was it rifled or shotgun injury? Anyone? Dr. Somira Mandal, Mahak. Was it rifle or shotgun? Okay, rifle. Fine. Rifle it is, right? Rifle for sure. So when you see in a rifle firearm, blackening, the answer is close shot. Okay, close shot is the correct answer according to me. If you see the standard textbook Case and Reddy in page number 171, it is clearly given blackening, that is due to deposition of burnt gunpowder, nothing but smoke particle, is a feature of close shot. So the answer is B is the best answer. So how many of you answered B, close shot? Close shot, how many of you answered? See, this is what the close shot. In close shot, you will see blackening. Blackening. Fine. What is the finding in near shot or intermediate shot? That is tattooing. Tattooing is a feature of near shot. In distant shot, there is no blackening, there is no burning, there is no tattooing. All these are absent in distant shot. So it is not distant, not intermediate. Intermediate are the near shot characterized by tattooing. In contact shot, definitely there won't be any blackening. The best answer is close shot. Okay. Good answer. Good. Singeing, fine. Okay. Singeing, blackening, all going. Whenever you see blackening, close shot. Okay. No doubt in that. Fine. Yes. Thanks for your comment. Okay. Second question. Again, standard concept from toxicology. You can correct me if I'm wrong in options and the stem of the question. Patients suffering from certain heavy metal poisoning presents with following finding. So there are two findings here, A and B. Options are lead, arsenic, mercury, copper. Same image given, right? Nimra Adoni, same. Okay, fine. So that is one picture A, that is your raindrop pigmentation. Raindrop pigmentation. And the B is Aldrich-Mees line. Aldrich-Mees line. So the answer for this question is your arsenic poison. Arsenic poison, also known as king of all poisons, characterized by raindrop pigmentation. Aldrich-Mees line can be seen in other conditions also. But raindrop pigmentation, that is specific to arsenic poison. Lead poison, Burtonian line is seen. Burtonian blue line at the junction of teeth and gum. Mercury poison, you will see tremors and mercurial lentis, basal ganglia deposition and all. Copper poisoning, you will see Clapton's line. Okay, Clapton's line over the gums. So the best answer is arsenic for sure, and it is a simple question. Red velvety mucosa. Okay, fine. Mees line wali image alag thi. Arsenic. Lead option nahi. Okay. Thallium was there. Fine. Thallium is one more option. Thallium was there. Okay. Red velvety mucosa. Fine. Red velvety mucosa. Okay. Anything else you want to add? Okay. Lead poisoning was not given. Thallium. So thallium also not the answer. Okay. Thallium presents with the different clinical presentation, not the raindrop pigmentation. Red velvety mucosa, that is seen in arsenic only. No doubting that. So the best answer according to me is arsenic only because of raindrop pigmentation and combined with your Aldrich-Mees line. Okay, fine. So this is according to K.S. and Reddy, page number 409. Okay. Next question. So this is whatever raindrop pigmentation, very commonly asked. This is your Mees line. Arsenic affect the mineralization. So that leads to these lines. Aldrich-Mees line. Burtonian line is seen in lead poison. Clapton line is seen in copper poison. Red velvety mucosa, that is also in arsenic poison. Fine. Next question. Now this question number 3. Let me read the question. Later, let's discuss about the options and the correct answer. During examination of pregnant woman with 37 weeks of gestation, along with the labor pain, gynecologist noted severe intractable postpartum hemorrhage, more than 500 ml of blood within 24 hours after birth. Emergency hysterectomy was done in good faith to save the life of the mother without the consent. Following is true. So I need help from you to create the proper options. So option A, clinician can be protected as law implies consent. Clinician is liable to civil negligence. Clinician liable to criminal negligence. Can be protected because of the contributory negligence. I got these 4 options from my sources. You can correct me if I am wrong in any of the option. Option Pallavi should have taken bed aid consent. Bed aid consent. Okay, bedside consent. Option A, counseling and attendance not required. Should have asked family. No contributory mentioned. Okay, contributory was not there. Okay, contributory was not there. Clinician not liable to do family counseling. Okay, protected as it is emergency. Protected as it is emergency was one option. So the gynecologist is there in the OT. है ना? So, and this postpartum hemorrhage is very dangerous. Patient might die at any time because of the hypovolemia and related complications, right? So this is done at emergency. Okay, it is not elective, emergency operation. So protected due to emergency. Very good. So the best answer is clinician can be protected because it was an emergency and it was done in good faith to save the life of the mother, where the law implies the consent. Let's see the reference. So this is the KSN Reddy reference, page number 34. And also you can see the lines here. Section 30 BNS. You know BNS, Bharatiya Nyaya Samhita. Section 30 BNS says that act done in good faith for benefit of person without consent is not an offense. Not an offense. The best answer is A is the correct answer. Clinician is protected. That is the best answer according to me. And also section 30 BNS supports this. Okay. Soumitra Mandal. Soumitra Mandal. Okay. 92, that is IPC. Both are same. Okay, 92 IPC. Now it is 30 BNS. 30 BNS. In OT, under the okay, no, under the influence of anesthesia, no, it is not valid, right? No, not valid. Consent taken inside the OT under the anesthesia, no, it is not valid. It should be before operation. Whatever consent that is taken before operation, that is a written consent, not inside the OT. Next, this is the simple question. A 25-year-old female, I think there was a line, female drug abuser with a history of drug abuse, presents to you with a mydriasis, tachypnea, tachycardia, sweating, diaphoresis. Probable diagnosis is morphine, cocaine, heroin, cannabis. Can you just correct me the options? Yes. Mydriasis go in favor of cocaine only. Why? Because in morphine poison, you will see pinpoint pupil. So definitely it is not morphine. Heroin definitely same pinpoint pupil. Cannabis not presents with all this tachypnea, tachycardia, sweating, all these are usually absent. So this is classical of cocaine poisoning. So how many of you answered correctly? Say yes in the group. Cocaine, how many of you answer? Okay, that's fine. And cocaine too very commonly asked question. Cocaine bugs, Magnum symptom, tactile hallucination, amyl nitrate, nasal swab, nasal septum perforation, speed ball. So there are many questions asked previously also. Cocaine is the favorite of examiner. Even in FMG also, INSEET also. Fine. Many answered. Nimra answered. Soumitra answered. Sahil Mitra answered. Rajshekhar. Very good. Very good. Congratulations. You are the winner. Okay. Okay. Next. Now this is one question asked. Let me read the question. Then we'll have discussion. Patient came with the complaints of photophobia, nuchal rigidity, altered consciousness. Lab report shows tachypnea, hypotension, hypocalcemia, high anion gap acidosis. What is the probable diagnosis of poisoning? Options are methyl alcohol, ethylene glycol, datura, ethyl alcohol. Okay. Anything can correct me about this question? No photophobia. ठीक है. Photophobia was not there. Fine. Okay. Nuchal rigidity was there. Altered consciousness. Hypocalcemia. Fine. Hypocalcemia was there. High anion gap acidosis, that is lactic acidosis. Diagnosis is. So methyl alcohol can be, but methyl alcohol hypocalcemia, that is not seen. Ethylene glycol is the correct answer. Okay. So ethylene glycol clinically presents with the three stages, stage 1, 2 and 3. And also in ethylene glycol, you will see calcium oxalate crystals in the urine. That is asked in your INACET exam. So the best answer is ethylene glycol. Was found unconscious, yes. So it is a CNS depressant, ethylene glycol, which is anti-freezing agent. It can lead to unconsciousness also. So the answer is B is the correct answer. B. You can see the reference from K.S. and Reddy, page number 441. So this is the calcium oxalate crystals. They are seen in case of ethylene glycol poisoning. Ethylene glycol, that is converted into glycoldehyde, converted into glycolic acid, and these metabolites leads to disturbance in the consciousness. And the drug used is omeprazole. So there are three clinical stages. Stage 1, that is about 12 hours, characterized by seizures and coma. There can be nuchal rigidity, cerebral edema and others, and also hypocalcemia. You can see here hypocalcemia. Hypocalcemia is a feature of ethylene glycol poisoning. Yes, good. Nimra Adoni, hypocalcemia was a buzzword. Fine. Next. What about this question? Question number 6. Metabolites in methyl alcohol poisoning. Was this the question asked in your exam? Metabolites of methyl alcohol. Formic acid, formaldehyde, lactic acid, glycolic acid, glycoldehyde, lactic acid, oxalic acid, calcium oxalate, acetic acid, acetaldehyde. Formic acid and lactic acid was there. Fine. Okay. So this question was asked. So methyl alcohol, you can see here methyl alcohol. This is methyl alcohol, right? Methanol. So converted into formaldehyde, formic acid, and also there is increased levels of lactic acid. In ethylene glycol, glycolic acid is converted into oxalic acid. In ethanol, it is acetic acid and acetaldehyde. This is we discussed many times in our classes. So this is okay. Fine. This question asked, the best answer would be formic acid, formaldehyde, and lactic acid is the correct answer. It is not the B, not the C, and not the D. Achha, patient with vision disturbances. Okay. Patient was having vision disturbances and vision loss. Anything else you want to add? vision loss. Yes, vision loss, loss of consciousness, all these are the features of methyl alcohol poisoning. Fine. Question number 6. Good. Now, this is simple question asked in your exam. In autopsy of death due to road traffic accident, inquest is conducted by, options are doctor, investigating officer, public prosecutor, defense advocate. Yes, any change in the options and the question? Anybody? Any change? Same. Okay. So it is definitely investigating officer. So it is nothing but police inquest. Police inquest. As you know, it comes under 174 CRPC. Now it comes under 194 BNSS. BNSS. The investigating officer is police officer. Sub inspector is the investigating officer. Best answer is B is the answer. No, in RTA, doctor inform police who will request for autopsy. Okay, see, it is the police going to request the doctor, not the doctor. So whenever question asked investigating officer, inquest, the inquest requisition given by the police to the doctor. Okay, so the answer is B is the best answer. Okay. Panchanama, yes, it is known as Panchanama, Panchanami. Yes, good answer, good. Anyway, we can see here in police inquest conducted by the police. Okay, you can see here. In executive magistrate conducted by executive magistrate, judicial magistrate as per 176 1A CRPC. All cases, police inquest is done except dowry death, exhumation, custodial death and other cases. You can see here this reference. Okay, now question number 8. The question number 8 that is taken from late postmortem change. That is, white waxy material with the preserved facial features is seen over the dead body found in water. Following is true about this condition. Options are: it occurs in hot environment, starts immediately after death, saponification of body tissues, commonly occurs in non-fatty tissues. Any correction about the options? Okay, Blueberry is telling not inquest, sir, as permission for autopsy. The permission requisition, that is by investigating officer only. We doctors do autopsy only after receiving requisition letter from police or magistrate. We are not the authority to do autopsy by ourselves. We need requisition from the police office. Okay. Even in unnatural cases, you are going to inform the police. Police is going to do inquiry. Then they are going to decide whether autopsy is to be done or not. Okay. Okay. Cold and dry. Okay, there was an option like cold and dry. How it can be cold and dry? No. It's a preservation method based saponification. Yes. So there is a saponification. So in adipose formation, there is a saponification. That is a well-known fact. So C seems to be a correct answer. It occurs in hot environment? No. It occurs in warm, humid environment, not in hot and dry environment. Starts immediately after death? No. It is a late postmortem change. It takes some time. Commonly occurs in non-fatty areas? No. It occurs in only in the fatty areas, usually over the abdomen and the thorax. Right? Any correction in this? Okay, adipocere mentioned in the question. Okay, adipocere was mentioned. Fine, that is fine. Okay. Now this question, microscopic image of some organism was given. It was unicellular algae in a case of drowning. The options contain silica coat, microscopic unicellular bacteria present only in bone marrow, are not resistant. Okay, so here are not resistant given, not resistant to acid and heat. Okay, Mathak is telling sir silica and chlorophyll. Silica and chlorophyll. Fine. Silica and chlorophyll. Acha, image was different but same diatom only. So diatom image was asked. Was there any drowning mentioned in the question? Drowning? Silica with chlorophyll. Okay, fine. Okay, it was there. Then fine. So diatom has very important role in deciding antemortem and postmortem drowning. So let's see the options. They are resistant to acid and heat. It is a wrong option. Okay. So they are not resistant. Okay. Option given not resistant. But in general they are resistant to heat and acid. Present only in bone marrow. That is wrong. They are microscopic unicellular algae. They are not bacteria. So A is the best option. That is, it consists of silica with chlorophyll. Okay. No, it is Manjunath Singh. It is a microscopic, right? Unicellular, right? It is a algae, not bacteria. Marker A. Good. Nimra Adoni. Good. Okay. Next, I think I need your help in this question. Question 10 and 11 both. Okay. 10 and 11 both. Let me read the question. Two fetuses are born either at the same time, showing different stages of development. Are fully developed fetuses are born at a different period, varying of 1 to 3 months. 1 to 3 months. Any correction in this? Options are superfetation, superfecundation, posthumous child, fixed child. 1 month it was given, right? Okay. But as per definition from standard textbook, okay, this is the definition in K.S.N. Reddy. K.S.N. Reddy it is mentioned. The page number 309. The best answer is superfetation. Superfetation is the answer as per K.S.N. Reddy, page number 309. Superfecundation, it has a different definition. Posthumous child, that is child born after the death of the biological parents. Fixed child, not the answer. So answer is superfetation. But not possible. That's why Nimra Adoni, it is rarely possible, or say it is not possible at all in human beings. But the definition from the standard textbook that gives the answer superfetation. If you see superfecundation, look at this definition of superfecundation and superfetation from the standard textbook. Superfecundation, fertilization of two ova which have been discharged from the ovary at the same period by two separate acts of coitus committed at short interval. Okay, this is the definition of superfecundation. And there will be fetus compressus or fetus papacius. So, but look at the definition from the standard textbook. This I do go in favor of superfetation. Okay. Okay, Mehtak is telling, sir, it didn't tell whether it was human or animal. Okay, fine. Was there any question like this in your exam? Fertilization of two ova which have been discharged from the ovary at the same period by two separate acts of coitus committed a short interval. Any question like this? If this is given, the answer is superfecundation. Superfecundation. No, it was not there. So this question was not there. Not there. Fine. Posthumous was asked in paper 1 in morning session. Atomism was asked in recent paper in INA-CET. Okay. And the last question, simple question. MTP in a 21-year-old, 10 weeks of gestation is done by following medical method. Following medical method. Options are very simple options. Mifepristone and misoprostol, intraamniotic hypertonic urea, ethacridine lactate, intrauterine installation of hyperosmotic solution. So in MTP Act, when you see from the standard textbook, less than 12 weeks and more than 12 weeks. Simple question. So the answer is mifepristone and misoprostol. Achha, dinoprostone was an option. Okay. Dinoprostone was option. Okay. Okay. Yes, oxytocin was an option. Okay. Oxytocin was an option. Fine. Not the answer. And anyway, it is covered in pharmacology. You can go through. Yes. So that's it about the forensic medicine question. I think 11 questions. 11 question asked. And all 11 are tricky questions, but they were from the previous year concepts only. Like example, you can see here from the beginning, if you see, analyze this paper. Firearm injury, very commonly asked question. Close shot and all. Arsenic, though, favorite of examiner. Repeat. This is little tricky, but you can answer. That is 92 IPC wala. Cocaine, favorite, simple one. Bit difficult, but ethylene glycol is favorite of examiner these days. Last 3 years, they asked more than 4 times. This is again methyl alcohol, simple one. Autopsy, it is a tricky one, but answer is simple. Adipocere, mummification, putrefaction, they are commonly as concepts. Question number 8. Diatom in drowning, very important. Suffocation was asked in the paper 1. Drowning was asked in the paper 2. And this is a bit difficult and controversial question. Superfetation. Last one is a simple. So this is about the forensic medicine question asked in your exam. What is your opinion about the? I feel forensic actually. Forensic paper 1 was tougher than paper 2. I feel paper 1 was bit tougher than the paper 2. But some student they say paper 2 was difficult because of indirect questions, not the direct questions. Indirectly they're asking. The image was given diatom and saponification and all. So some students are having the feeling that paper 2 was tough. According to me, paper 1 was tough than the paper 2. Okay, so that's it about the FMT questions. So what is your score out of 11? Can you just message me in the chat box? Out of 11, how many you got correct? 11. Okay, Nimra Adoni got 10. Great. 10. Pallavi PK, sir. Okay, 9. Ishita Singh, 10. Oh, scoring. Forensic medicine is a scoring subject. Jackson, 9. Nam 9, Omkar Sira 9. Good, good. So it is a good to see that many had answered correctly in paper 2. Mac Rajput 9. So that's it about the discussion. Wish you all the best for other upcoming exams. Thank you.